10 steps to tackling coronavirus. Our president-elect has been downplaying the new virus that is wreaking havoc all over the world while attempting to talk up our economy and our stock market. We have a general idea of how many Americans are infected, but we don't have a specific number. South Korea, meanwhile, has conducted 700 times more tests per capita than the US. While Trump's choice of taking a passive stance on this issue may cost lives, we don't have to sit idly by and watch hospitals become overwhelmed by a pandemic that is way more contagious and deadly than the common seasonal flu. Dr. Tom Frieden, who is a former director of the CDC, Centers for Disease Control, warns that in the worst case scenario, this infectious disease could kill more than 1 million people in the US. Here are 10 steps that our president and government officials can take while there is still time. Number 1. Invest in a huge rollout of free testing so that we know who is sick. Recently, the University of Washington set up a drive-through system so that certain people can be tested without contaminating a clinic. South Korea did the same. We are in urgent need of rapid tests that have the capability of offering results in minutes, as well as tests to determine who has had the virus and who has not. Number 2. Cancel large gatherings in parts of the country where the community spread of the virus is occurring, just like they did in Washington state. Employers should encourage people to work from home whenever possible and avoid public transportation. It is believed that even with social distancing, more than 1/3 of Americans may eventually be infected. Lives will be saved by flattening the infection curve so that infections grow slower. We are much better off if 50 million people contracted the coronavirus over 12 months rather than over 12 weeks. This will also allow scientists the chance to test treatments and develop vaccines. South Korea's experience suggests that aggressive measures do help. Number 3. Expand telemedicine so that patients can get medical advice while staying home. That way people do not have to go to a doctor's office or ER unless it is an absolute must. Number 4. Plan for hospitals to be overwhelmed, just like it is currently happening in China, Iran, and Italy. According to epidemiological models, by late April, millions of Americans will be potentially infected, and the danger is that people with other medical conditions could die as a result of a lack of care in the midst of all this chaos. Several epidemiologists suggest that infections could easily reach 100 million in the United States, of which 5 to 10% of the infected may require hospitalization and 1% may need the assistance of a ventilator. At these projected numbers, almost 1 million people will be needing ventilators. However, the US only currently carries about 72,000 full ventilators. Number 5. Cancelling the vacations of health workers, bringing back retired doctors and nurses, and repurposing cardiologists and pediatricians to deal with the incoming flood of coronavirus patients in preparations for the record number of doctors out sick. Don't forget, our healthcare workers are in constant contact with those that are infected, so there is a high chance that they can get sick as well. We should prepare to allow military medics to assist in emergency rooms as well. Number 6. We should limit the number of visitors in nursing homes, assisted living centres, homeless shelters, prisons and dialysis treatment centres, as well as encourage the use of protective equipment by everyone, including staff members. Number 7. Create backup plans in case our first responders, such as police, firefighters, and ambulance paramedics become sick. We may even be required to call in the assistance of our National Guards. Number 8. Congress should quickly pass a legislation in which there is mandatory paid sick leave for all workers. The last thing we want is those that are sick infecting the rest of us that are healthy. Number 9. Immediate increase of the rapid production of personal protective equipment that are needed in hospitals. Some hospitals are already running short of N95 masks because a lot of people are hoarding face masks, and America's emergency stockpile has only 12 million N95 masks. This may seem like a lot, but it only equates to roughly a 1-day supply for the country in the event of an epidemic. Number 10. Prepare for school students to attend classes remotely or online. Research has shown that during the 1918 Spanish influenza, cities that cancelled schools and public gatherings did much better compared to cities that didn't. However, one issue with that is currently at least 6 million American school children don't have internet access at home. One possible solution to that can be schools handing or loaning out hotspots and laptops to students without computers. One current non-profit organisation called First Book is trying to send out 6 million books to low-income schools so that at least children can read while they're at home. Anyways, guys, let me know your thoughts and ideas and comment down below for more videos. Click the like button below and subscribe.